My name's Siobhan Dolan. I'm one of the doctors here at the Comprehensive Family Care Center at Montefiore Medical Center, and we're going to be taking you through the prenatal care clinic this morning so you can see what we do to work with women to provide them with excellent prenatal care. What we do during prenatal care is talk to women about a whole host of issues, provide them with lots of advice for their pregnancy, and help them detect any problems that come up throughout their pregnancy. By doing this, we can help women have healthier babies, babies that are less likely to be premature, and we can also help women with their own health. A full-term pregnancy is 40 weeks, so for the first 28 weeks or so, we see you about once a month. Then the visits get more frequent, going to about every 3 weeks, then about every 2 weeks, and then after 36 weeks, we see you weekly. Great, so welcome, Andrea. Congratulations on the pregnancy.
Thank you.
This is so exciting.
Yes.
Oh,
very
good.
excited.
One of the first things you want to do is find out about your medical history, because things that have happened in your medical history or your family's medical history may be relevant to this pregnancy. So the type of things we like to know about are diabetes, hypertension, or any other pregnancy complications that occurred either in your pregnancies previously or sisters or your mother. We test for some infections such as syphilis, and we'll also offer you a test for HIV. We ask you for your consent for that, so what do you think of that? Have you thought about an HIV test while you're pregnant?
Definitely a clean bill of health is the best gift that I can give to my baby, and I'd like to find out all of the information that I can.
Another important question, Andrea, is medications. So were you taking any medications when you became pregnant?
No, I was not.
Now how about right now? What are you taking?
My preconception visit, my doctor then told me that I should start taking a multivitamin,
That's
folic
great.
acid, so I started that before.
Oh, that's great. It's really important for women to take a multivitamin before they become pregnant, and then once you become pregnant, switch over to a prenatal vitamin. Although the vitamins are very similar, the important factor is that we have high levels of folic acid, which is so important for pregnancy outcomes. And I imagine that the medical assistant weighed you today on your way in.
Yes.
And how did everything look?
Everything looked great. She said I was within normal range.
That's great. The important thing there is that it's not weight alone, but weight for height. And we want to see where you are before you become pregnant in the early part of pregnancy, and then we'll give you weight goals. For yourself, given that you're healthy and at a normal weight, the average weight gain we'd expect is about 25 to 30 pounds. So Andrea, the other things you probably did on the way in were have your blood pressure checked and have your urine dipped. Did you have those two things?
I did.
What we watch for during pregnancy is a rapid change in blood pressure. So we look at the baseline blood pressure, and if it jumps from that baseline, then we start to be concerned about gestational hypertension, or in its more severe form, preeclampsia. Let's talk about your pregnancy and when your due date is. The way we date a pregnancy is we start with the first day of your last menstrual period. And some people ask why, and the answer is probably just that that's a day we can identify. Starting from the first day of your last menstrual period, we calculate forward 40 weeks, and we often use a pregnancy wheel. This is a pregnancy wheel, and we'll line up the arrow here with the first day of your last menstrual period, and that helps us calculate forward to 40 weeks, and that's going to be your due date. So with my handy dandy wheel here, I calculate with a last menstrual period of May 19th that your due date is February 23rd. Is that what you had in mind?
Yes.
Okay, great. So you'll have a nice cozy baby in the winter. That should be terrific. At the first visit, we take some tests. The first is a pap smear test, which looks at the cells of the cervix to make sure there's no cancer cells there. We also take cultures of the cervix to assure that there's no infection. So what we do is we have you put your feet up here on the stirrups. We'll place a speculum in your vagina. That'll allow us to see your cervix. Then we take some cells with a brush for the pap smear. We take some material with a Q-tip for the cultures, and then you're all done. After that, we do what's called a bimanual exam, and a bimanual exam is where we feel with two hands, one in the vagina and one at the top of your uterus, to feel that your uterus is growing appropriately.